So Adrian and I have been working together for the last 4 years, and I was prior to that working with him at Basingstoke on his fellowship. And what we decided was, when we came to London, was to work together. So every patient that we see, we discuss any complex injuries, and the saying is true that two minds are better than one, and we go through all the different complex problems that a patient may face. So whether that's the complexity of the injury and how we're going to tackle the surgical problem in front of us with two minds working on it together. So it really eases the way that we look after our patients. The patients get a peace of mind that they've got two experts looking after them, and it also makes the surgery extremely efficient. So it can be quite a stressful environment operating on a complicated scenario with one surgeon alone working with an assistant who may not necessarily know or anticipate the surgeon's next move. Whereas when the two of us operate together, it's a lot smoother, it's a lot slicker, far more efficient. And we know that outcomes are completely related to the time it takes to do the procedure and how well the procedure is done. So whereas a surgery may take an hour, the two of us doing it together will reduce that time by at least 20 to 25%. So far what we've noticed in our outcomes with our patients, the patients have been very happy, the outcomes have been good. We don't see infection as a big problem within our practice. And so having the ability to work together has made a really positive impact on our surgical performance. We first came across this concept when we went to visit our friends and colleagues in Hanover. Christian, who you'll see later on, is part of the team, and he was working in Hanover with his good friend and colleague Philip Lobenhofer, and we just saw that the flow in theatre was fantastic. They were doing lots of complicated cases together, they were making it look incredibly easy, and it was just a very efficient way of looking after the patients. Nowhere in the UK has this been done before, not that we are aware of, where two orthopaedic surgeons work together to do from the most simple cases such as knee arthroscopy to the more complicated such as revision cases that are done by two surgeons. In fact, in the UK, what you mostly find is that people are working either by themselves or with an inexperienced assistant such as a nurse or a junior doctor to help them with these quite complicated cases. So as far as we're aware, this is not going on elsewhere, and we believe that this concept is the way that the future of surgery is going to be.